In the Jesuit tradition, the Center for Service Learning at RHCHP was established in 1996 and continues to cultivate in students an understanding of their personal responsibilities and an appreciation for the diversity of our global community. Through service learning, students leave behind the world of books and laboratories and enter communities grappling with urban poverty, racism, hunger, inadequate housing, famine, or minimal or no access to healthcare resources. Amidst these grim injustices, students also experience the resilience of community, the wealth of cultures and traditions, and the unsung leaders who continue to uphold their communities. Service learning is integrated into the core curriculum of most of our academic programs, allowing faculty to use this tool to enhance effective teaching and student learning. Our goal is that the students who participate will not only gain an understanding of their ability to impact their community and make a recognizable difference, but also they'll learn of their responsibility to use their gifts and talents to contribute to a more just world.
I think we have an obligation at Regis University for our students to integrate themselves into a community and to have an impact on it in a positive way. I think that is integral to learners becoming leaders, and I think it's particularly helpful for healthcare professionals.
Service learning is not about me, it's not about what I bring, but it's about the privilege to serve the community that's allowed me to participate.
I think the students get a sense of awareness of the programs that are available in their community when they work with adaptive recreation. So they know what's available to people with disabilities to participate in a community therapeutic recreation setting. They also kind of get a sense of stewardship, I think, by participating in the program and ownership, because they do so much for us.
The value of this program is I get to learn that out there in this world there are plenty of people like me. I'm not the Lone Ranger. There are a bunch of head injured people out there, and it's opened my mind up to how many of us there are out there.
The value of participating with Nine Health Fair or any other community endeavor, I don't think it can be overstated. First of all, at the end of the day, working in a health profession means working with people. It means having really good listening skills, communication skills. That's the only way to really help somebody get better and be able to take care of themselves. And so for health professionals to be knowledgeable about all the things that affect individuals' access to getting the health care they need will really strengthen their ability to help each individual that they work with.
The value of integrating service learning into the curriculum across all the programs in the health professions ranges a great number of things. One of those is the idea that our students learn that they have an obligation to serve over their entire life and that they need to give something back in the health professions. Secondly, it enables them to understand people from a broad range of cultures, understand the needs of others in that context as opposed to their own context, and to be able to put themselves in the shoes of those that are less fortunate and for those for whom we hope they'll spend their life trying to serve.
Service learning contributes to me being a better nurse by me being more aware of the needs in the community. My eyes are drawn to newspaper articles, magazine articles, always looking for a way to plug in. As a student, to be able to have that experience, I just think that if you don't have that in terms of your education, you're really missing out. It's important to serve the community that you live in.
Students get to see the people out in the communities, people that they might not get to see otherwise. They get to learn with their classmates, and they probably come back with more questions than answers. But I think because we invite reflection and we don't just stop at, Okay, you've gone out and you've done your service, and that's great, you've done 20 hours, fill in your blanks, but so what impact has this had on you, and you know, what are you going to do about it now? They get to meet people who are actually working out in the community as activists, as people who are interested in changing our society into a more just society.
This was the first time that I encountered homeless families, and I had done some volunteer work in the past with homeless people, but never in the context of a family. I also wasn't aware of how much homelessness is a problem for families in the Denver metro area.
From these experiences, I learned that it's easy to judge a person as you walk down the street and look at them, but until you've really walked in their shoes and understood what they've been through, it's very hard to learn not to judge people and to appreciate that, but for the grace of God, this could be myself and my family.
I would say I've concretely learned the ability to jump in a situation that can be somewhat uncomfortable, interacting with people maybe that you don't normally interact with, and being able to be open to the experience of that. Look at what is it that I can learn from this experience.
In order to really embrace and to continue to learn within a service learning environment, you need to be willing to open yourself up to new things, and sometimes even step outside of yourself, which can be very, very difficult. I think that it's a process. It's going to take a lot of time for someone to actually establish how one ought to live, but service learning gives you the opportunity to test that and to also develop it. And I think that that's happened within the past couple years that I've been here.
The face of poverty, the face of homelessness is not really seen until one gets out in the community and comes face to face with it. So I feel like it has made me a better nurse because it has increased my awareness of need, not only within my workplace right now, but in the wider community.
We see people and patients in the hospital from all walks of life, all situations, and from the things I saw and experienced in my service learning and learning not to judge, the book, The Person by the Cover, will help me to be a better nurse and not to judge my patients.
I think it's important to interact with people and different populations you're not normally exposed to in order to be a more effective healthcare professional. So I think our students will be able to take better care of their patients, be more empathetic, understanding, if they've had interaction with different types of populations before graduation.
I think the value for the students working with 9 Health Fair is the real life experience and the fact that they're going to be working in fairs that serve diverse communities, and I think that'll help them in the future.
Going into service learning, try to go in with an open mind and understand that it isn't necessarily what you do that's important. It's the connections you make with the people that are really going to resound and really connect with you.
I think they need to go out without any fear, and I know we all have fears about, maybe facing an older person with dementia, and how do you even talk with them when they don't interact back with you. But for the most part, just open your heart and learn as much as you can, give as much as you can.
Each person has their own unique calling, and I think when one just sort of gets quiet and thinks about who their heart reaches out to, who they would like to help, that there's a certain internal response to that of yes. And I think it's just taking time to listen to what your heart desires and saying yes to that.
I would tell each student to approach service learning as an opportunity to make a difference, and it's probably one of the most rewarding things that you will find that you were experienced during your time at Regis, and look at it as an exciting challenge to find out more about yourself and more about the world out there around us.
Come out here with an open mind. Be ready to experience anything. It's not a closed thing where you have to be careful with your money or be careful with your feelings. Just come out here and have a good time.
students are being prepared while they are here to go into the world as competent health professionals and citizens, I think service learning is an important component of preparing them in this way. Service learning is fundamentally challenging students to be the leaders in service to others that Regis wants them to be, and hopefully giving them the interest and tools to make a positive impact, not only in their profession, but in the communities in which they decide to call home.